everyone, this is Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, the city of joy. I have been heading the Poorva International Orthopaedic Foundation and Momentum Orthopaedics, and it's our endeavor to provide the best in healthcare, best in orthopedic surgery treatment, orthopedics treatment to everyone who deserves it. Personally, I have found that many people who suffer from these diseases, especially the rare diseases, they do not know where to go. They don't understand the disease, what has happened to them. They are misguided several times, and not knowing what to do, several times they go outside the state, they go to other parts of the country, and they spend a lot of money in that without even knowing that the very best, the very much affordable treatment is available right here in the city of joy in Kolkata. And the purpose of this our YouTube channel is to provide informative education to those who are suffering from disease. And if you are suffering from any of these orthopedic issues, orthopedic problems, please do come to us in Kolkata. We'll help you in all possible ways. We'll give you the world's best treatment at the most affordable prices right here in Kolkata. And not only that, we'll help you with your appointment, your visa, your travel, your stay, everything, whatever you will need, because it's not just our work to do the surgery, it's our passion to help you, and we feel to be proud to be a part of you, to be in your company. If you get benefited from us, that's the biggest happiness that we get. So today in this series we'll be talking about ankylosing spondylitis. Well, ankylosing spondylitis, where many or rather most of the people, they just get confused. Talking of people, I'm not talking of specialist people, I'm talking of laymen. So they get confused and they think that ankylosing spondylitis is same as spondylitis. No, ankylosing spondylitis is a genetic disease which affects mostly in the lower age group, in the young age group, and age-related wear and tear, which we commonly call as spondylitis, is entirely different thing, which affects in the senior citizens in the older age group. So that's completely different thing. So what we are talking of today is ankylosing spondylitis, which is a genetic disease. Now, the gene which has been identified to be the carrier of this disease is HLA-B27. We will be discussing mostly the clinical aspects of ankylosing spondylitis. Well, ankylosing spondylitis starts with inflammation. What inflammation means? It starts with inflammation of the spine ligaments, joints and hip joints. Inflammation means there is a chemical reaction which is characterized by intense pain over that area, and starts with pain and gradually it goes on to fusion and stiffness. So ankylosing spondylitis is not a disease of one particular joint. It's a systemic disease. What it means, it involves lots of parts of the body. It involves the spine, the cervical spine, the lumbar spine, it involves the hip joints, it involves the eyes, it involves the abdomen, it involves chest. So multiple symptoms are there with ankylosing spondylitis. Starts with back or neck pain and stiffness. There may be hip pain, joint pain, neck pain, difficulty in breathing. There is difficulty in breathing because it involves the joints of the ribs. So the ribs are expansile, rib cage is an expansile organ which moves with inspiration and expiration. And this expansibility is diminished in ankylosing spondylitis because of this fusion. This fusion is, the ligaments get calcified and they get fused. There is fatigue, there is loss of appetite, there is loss of weight, there is abdominal pain, skin rash, and sometimes visual problems. This visual problems is because ankylosing spondylitis is associated with uveitis. Another hallmark of this ankylosing spondylitis is sacroiliitis, which is inflammation which involves the sacroiliac joints. So it starts with inflammation in the spine and the sacroiliac joint. This inflammation is at the ligaments which connects the bones. So this is the inflammation starts there, and it gradually it is very painful to start with. It is very painful to start with, and gradually after the inflammation subsides, it goes into fusion. Once the spine goes into fusion, it gives the appearance of a bamboo stem, and we call it bamboo, which is called bamboo spine. It looks like a bamboo. So that is in this stage there is stiffness, and pain gradually diminishes, and then stiffness. There is sacroiliitis. Sacroiliitis means the part of the spine which is attached to the pelvis by the joint, that is our sacroiliac joint. So there is sacroiliitis. That is characteristic of ankylosing spondylitis, uveitis, sacroiliitis. And as we can see in this model also, this is the sacroiliac joint, this is the sacroiliac joint. The sacroiliac joint goes into fusion. There is sacroiliitis. So in hip, After the spine and sacroiliac joint, it affects the hip joints. There is fusion, there is inflammation in the hip joints, and this causes intense groin pain. There is difficulty in walking, there is painful limp, and there is intense difficulty in sitting in a chair, especially low chair. There is rest pain also. The pain is persists while sleeping also. So all these are the features of ankylosing spondylitis. Now it is a disease which gradually progresses over years. It doesn't happen suddenly over few months or years. So for that, it's very important that we diagnose the disease earlier. Once the disease is diagnosed earlier, we can do certain physical therapies. We can give some disease modifying agents. We can give biologics which can modify the final outcome of the disease. We cannot pull away the gene and throw it at the present moment. Of course, in future it may be possible by gene editing technologies which are on the way, but at present we cannot throw out the gene. So we have to manage the progression of the disease. We have to slow down the progression of the disease. We have to minimize the stiffness. So it is important to diagnose the disease early. The treatment starts with physiotherapy and exercises. There are multiple flexibility exercises which have to be done. Swimming is very good. Yoga is very good for this. In this physiotherapy and exercises, we have to give several times anti-inflammatory painkillers, NSAIDs, non-steroidal anti-inflammatory painkillers. We give biological treatments which are known as monoclonal antibodies or biologics, and these are immunomodulators which modify the outcome. They decrease the stiffness, they decrease the inflammation. So several times steroids are used, although with the onset of biologics, the immunomodulatory treatment, the role of steroid, the use of steroid has come down. There are disease modifying anti-rheumatoid medicines are used. The same medicines which are used in rheumatoid arthritis are also used here. Then of course when the fusion takes place, arthritis takes place, then we have to undergo surgery, which is mostly in the hip joint. If the hip joint becomes arthritic and fused, we have to undertake a total hip replacement surgery, because hip joint arthritis is very painful. It is painful even at rest. It makes sitting very difficult. Person is not able to sit also. In that case, we have to undertake hip joint replacement, and it's a very life-changing surgery, because overnight the person changes. When ankylosing spondylitis affects the hip joints, then initially there is painful limp, that is the person feels difficulty in walking, there is painful limp while walking. Then after some time rest pain starts. After some time patient feels very difficult to even sit, because the hip joint is very important for sitting in chair, especially low lying chair. Patient gets pain while sleeping also, rest pain, night pain disturbs sleep, and it's very difficult for the patient to manage with this pain. In that case, we undertake hip replacement. Hip replacement is a life-changing surgery. It's a life-changing surgery in which the ball and the cup of the hip joint is replaced, and this ball and cup, once it is replaced, it gives complete freedom from pain. It restores painless and stable movement. It restores the range of movement, and the pain is gone completely, and the person starts walking from the very next day of surgery. Although full recovery may take 1 to 1.5 months, but person generally starts walking from the very next day. And present day hip replacement implants are very, very advanced and developed. There is a non-cemented socket. This is known as socket, which is the shell of the cup. And then we have a bearing surface which can be ceramic or polyethylene. Presently we are using ultra high molecular weight polyethylene, and this is the head which is used, which can be highly polished cobalt chromium, or it can be ceramic. And then we have the stem. Stem is all porous coated or calcium hydroxyapatite coated for press fit and fresh bone ingrowth. That is very, very important. And these are the various stem technologies that are used. Stems for total hip replacement. It can be cemented. It mostly in young people it is uncemented, but it can be cemented also. And it can be proximally coated. It can be fully coated. See, whatever. But one thing we must remember in any joint replacement, whatever may be the implant used, several times it has to be decided by the surgeon. It may not be your decision. But the single most important thing in joint replacement is precision, precision, precision. It is the precision, it's the mechanics, it's the mechanical factors which determine the longevity, the survivorship and the performance of the implant. So single most important thing is surgical skills and precision. Implants, of course, it has to be good, but single most important thing is surgical skills, precision. Hence, the single most important thing is the surgeon. So we have today discussed about this ankylosing spondylitis and the issues associated with ankylosing spondylitis. You can always let me know about your views, your problems, your queries by sending me mails to santdr@gmail.com. My email ID is santdr@gmail.com, or you can WhatsApp me at 9831911584. I repeat my WhatsApp number 9831911584.